Hello, I'm Dr. Tanvi Vaidya. I'm a consultant dermatologist and dermatosurgeon, and I'm here to talk to you today about hair transplantation. There's a lot of myths out there, a lot of fear in the market. Typically, everyone's really scared because the media tells you very scary stories of what happens in hair transplants. So I'm here to give you some hardcore facts, whether you're contemplating a hair transplant, whether it's the right choice for you, whether it's not the right choice for you. I hope this video will help you to make that decision. I'd also request you before proceeding, if you like this video and if you find this informative, do give this page a follow, do subscribe. That would really keep us motivated to keep making such content. Now getting started. What is a hair transplant? A hair transplant is a procedure where we literally transplant hair from a site of your body, of your own body, where there is enough growth, and we transplant it into an area where you don't have enough growth. Like for example, typically in males, you lose hair from your hairline starts receding, your vertex starts thinning. That's called a male pattern hair loss. In females, you start, your central partition starts widening, which is called a female pattern hair loss, or your temples start really thinning out, which are common areas in females. Now, in such areas, we are transplanting follicles from another area to this area. There are typically two types of transplants that are usually performed. It's either FUE, which is follicular unit extraction, and there's a follicular unit transfer, which is FUT. FUT is literally where you take a strip of the entire skin with all the overlying hair and transplant it onto the recipient area. But that's almost obsolete because results aren't all that great. FUE is what we do. In FUE, follicular unit extraction, we literally extract one follicle at a time, one follicular unit at a time. We extract it with a punch from this area, the occipital area, most of the time. That's called the donor area. We don't strip that entire area bare, we just extract follicles in between. Now we can also take it from other body hair areas like your back, your beard, chest hair. All of these areas can also be used, but the area of preference typically is the occipital area. From here, we take those follicles, we make slits in the recipient area, and we transplant those follicles there. Now, how it's transplanted, the direction of the slits, how many follicles to take from the donor area, how many to transplant into this area, how to segregate those follicles, which are the healthy ones, which are the multifollicular units, which are the single follicular units. The single follicular ones would form the hairline. How to create a natural looking hairline. These are all things that define a good surgeon. So choosing your surgeon well would make all the difference. When we create hairlines, it is a work of art. It's something that we really take pride in creating a very natural looking hairline. So no one should be able to tell that you've really done a transplant. Now, when do you know you need to go in for a transplant? One is if you've tried conservative methods for a while and they haven't really worked out for you. Like for example, if you've been on, say, your serums, your minoxidil or your peptides, you've been on oral medication, whether it's oral minoxidil, dutasteride, finasteride, you've tried PRPs, you've tried exosomes, and it's not worked out for you. Or in the first place, by the time you realize, oh, I've really thinned out, it's really thinned out. Because when you do conservative methods, you can only regrow about 30 to 40% of your hair. All of your hair is not going to come back. So in the first place, if you have a huge amount of scalp visible, then it may not make sense to waste too much time on conservative therapies, and it makes sense to then directly go in for a transplant. Another situation is in men. When your hairline has receded so far behind, a receded hairline where there is absolutely no hair now on this extended piece of your forehead is not going to grow back through minoxidil, through PRPs, through anything. Only a transplant will grow that back. So these are the indications when we go in for a transplant. But before we go in for a transplant, we also assess whether your health conditions are optimal, whether your donor area is good enough. We have to assess your donor area. That's super important. Do you have enough follicles in the donor area to make it to the front? So that's super important. We have to assess how many follicles you need. Usually if it's about 3,500 follicles, we can do the surgery in one day, in one single sitting. If you need more than 3,500 grafts, then we need to do this on 2 separate days. The number of follicles extracted really goes up in that case. We also look at your lifestyle and certain other factors, like for example, in smokers, the chances of graft uptake really drop down. So you really need to stop smoking if you want to conserve your hair, or if you're contemplating a hair transplant surgery. Please consider at least cutting back, if you can possibly completely stop smoking, because that has a huge impact on the success rates of hair transplant. Coming to the actual process of the surgery, it's a day surgery, as I said. Either we do it in one sitting or we do it in 2 sittings. The surgery is done in local anesthesia entirely. So you're conscious, you're talking to us throughout the procedure. We can even take a little break and have a little lunch break and come back. So it's a very basic surgery, so to say. It's not a very major surgery. There's no major general anesthesia or anything like that involved. But in saying that, we have to be really careful. You need to go to a good center where they know how much anesthetic to inject into your scalp. Post-procedure, what can you expect? This is really important. You should know this. Post-procedure, for the first 1 to 4 days is the healing time. In the healing time, it's very obvious you've done something. There could be heaviness in your head, there could be pain, there could be a lot of swelling on your face or your eyelids, which of course this complication is minimized because we've started now giving you a headband to prevent that swelling from happening. Why that happens is because the anesthetic fluid that we inject locally into your scalp, that literally seeps down. Even if you don't do anything about it, it is something that will settle on its own. But in saying that, it's always better to wear that hairband so it doesn't look that terrible in the first 1 to 4 days. Also, in the first 4 days, you're going to have to keep spraying your scalp, all of those transplanted areas, with normal saline, which of course we would be giving to you. You got to keep spraying it to keep your follicles alive. The blood supply from our bodies to those follicles has not yet established. So when you plant a new plant, you have to take extra care of it till it settles into its new home. So that's super important. In the same way, we need to really take care of these transplanted follicles in the first couple of days. In the first 4 days, you're not supposed to wash your hair at all. Rarer side effects initially can be folliculitis, which is infection of each of those follicles, which is why you have to really take care to maintain infection control. We also, of course, give you antibiotics and anti-inflammatories to take care of all of that. Sometimes you could have altered sensations. You may feel very less sensation, or you may feel hyper-aesthetic, like the slightest of sensation may feel like a lot to you. That's because of nerve handling, which settles usually in just a week or 2. So nothing major to worry about there. Then comes from day 5 to day 9, you can actually start cleansing at this point. Sometimes there's a little bit of a crust or a scab, which you can gently remove. So you can just start cleansing by day 5 to day 9. Later, from day 10 to day 14 is when you can actually start shampooing. Okay, very gently, of course, very mild shampoos, but you can start shampooing. If you want to wear a cap or a hat, you can start wearing a cap or a hat around this time. It takes about 2 to 3 months for that hair to now start growing like normal hair. So in that period, a lot of our patients usually wear a hat so that it doesn't look very evident. But in 2 to 3 months, that growth starts normalizing. Usually by 5 to 8 months, a majority of the hairs start to grow completely normally. By 10 months time, no one would be able to tell that you've done a hair transplant. It completely integrates with your natural hair. You can get your regular haircuts and everything is completely back to normal, so to say. In terms of longer term complications post hair transplant, sometimes there can be over harvesting in the donor area. Of course, these are very rare, and this doesn't happen if you've gone to the right surgeon who knows what they're doing, who knows at what intervals you need to harvest from the donor area. People who over harvest, every second follicle they've literally harvested. That's when it can lead to a lot of complications. There can be scarring, there can be necrosis sometimes, there can be something called shock loss. There's a lot of these terms, but this usually doesn't happen when you go to a qualified dermatologist or a plastic surgeon who's trained in hair transplants. Some other complications, or more specifically to say why some hair transplants fail. That is, even after doing a transplant, their hair fall has progressed. That is, in one case, if the transplant has been done in a patient in whom the hair fall itself has been very rapidly progressive. That's not ideal. If you know that their natural hair thinning is progressing too fast, maybe a transplant isn't the right thing to go for at that stage. Second thing is, people get overconfident. This happens very, very commonly. People say, I've done a surgery, now I don't have to do anything. That's not true. You still have to do your minoxidil applications. You have to still take care of that hair. You should not be smoking. Your lifestyle is very important. So people who stop literally taking care of their transplanted hair thinking, I've gotten a surgery done and I've paid so much money and now I'm good, that's when that hair fall restarts. So it's very important to take care of your transplanted hair as well. Lastly, coming to a more serious topic is why the deaths. This is something that has really shocked a lot of us. In India, we've seen a bunch of them. In Turkey, which used to be the hair transplant capital of the world, we've seen a bunch of these deaths happening. Why these deaths happen is because of a lack of standardization. Unfortunately, in our country, no one is checking the qualifications of the hair transplant surgeon. No one is checking, there are salons putting up ads that, hey, we do hair transplants. I'm sorry to say, but this is not child's play. This is a surgery. I know it's not a general anesthesia requiring surgery, but it's a local anesthesia requiring surgery. It's a major surgery. There is a significant risk when you overdose the local anesthetic, or when you aren't choosing your patient selection properly, when your sterilization protocols are not up to the mark, when your OT could be infected. You need an operation theatre. You can't just do it in a salon in a back room. This is something that needs to be taken seriously. So I would really request everyone watching this, particularly I'm guessing if you live in India, please be careful, because no one else is being careful in this country. There is no regulation. Please choose your doctor well. Only a dermatologist, a plastic surgeon, a maxillofacial surgeon, not any regular dentist, or an ENT surgeon is qualified to perform a hair transplantation surgery in India. Even amongst them, talk to your doctor, ask them. Anyone who has the right qualifications is never going to hesitate to show you their degrees. Ask them for their degrees. Please feel free to do that. Ask them to show some before after pictures of the work that they have done. Make sure they have done that. Look for word of mouth references. These are very important factors when you choose your surgeon. If you were considering a hair transplant surgery and I've managed to answer your questions, I really hope you found this video helpful. Do subscribe, do comment if you have any more questions, and I'll see you next time.